Got it?
Yeah.
See, I don't know how to make the people bigger though on the thing. I think you click on that.
I think I'm on speaker. Hey Celeste, can you hear me? I can't hear her. Why can't I hear her?
Here, because she's.
Oh, I was muted.
Oh.
Can you hear me?
Yeah, I can hear you.
Can you open that? Make it bigger to see everybody? What's the other two? What's the other one?
What?
Click on here and then. Yeah, and then when each people come on, you can.
Okay.
See everybody.
Thank you.
You're welcome.
I was having issues with my PowerPoint this morning.
Oh, okay. Did you get it fixed?
Yeah. No. Can you see the? I'm sharing my screen. Can you see it?
Yep, I sure
Okay.
can.
That's good. Boy, been a rough morning. Busy. How are you doing?
I'm better today. Mine has been a very rough week.
Yeah, I'm definitely looking forward to the weekend. I got work to do, but at least I can do it. What can I get you to do today? 4-way test, pledge. What can I get you to do?
I'll do the 4-way test.
Okay.
Oh.
To start, we've got a great meeting planned. I'm looking really forward to hearing our chief talk today. Mark, can you do the Pledge of Allegiance? Mark, are you there?
He's not on.
Mark,
Mark's not there. I'll be glad to lead it.
go ahead.
All right. Please join me in the Pledge of Allegiance to the American flag. I pledge allegiance
to the flag
of the
United States of America
and to
the
the
republic for which it stands,
one
nation
nation,
under God,
indivisible, with
liberty and justice
for all. Thank you.
Thank y'all. The Texas flag is Pete. Well, Pete, can you lead us in the Texas flag?
You have to unmute yourself.
I pledge allegiance to thee, Texas, one state under God,
One
one nation, indivisible.
One and indivisible. Right.
Thank you, Pete. We'll go ahead and start with the 4-way test. Celeste.
Please join me in the 4-way test of the things we think, say, or do. First.
Is it the truth?
Second.
Is it fair to all concerned?
Third. Will it build
goodwill and better friendships?
Fourth.
Will it be beneficial to all concerned? Rotary.
That 4-way test means a lot. I wish we could do that across the country today. Our Rotary prayer is George Webb.
Oh God,
Giver of all good.
We thank you
Thank
for
you
all our daily
all our
for the
daily
gifts.
gifts.
May Rotary
Rotary
friends
friends
and Rotary ways help us to serve you through all our days. Amen.
Okay. Sharon, are you here?
Yes, I am.
I want to let you talk a little bit about the Samaritan since we're trying to get that.
Yes, July is the charity of the month, is the Samaritan Inn, our homeless shelter. They're hosting 145 people right now. 44 of those are children. And they're really in serious need of jugs of bleach, hand sanitizer, the smaller, medium size, or hand sanitizer wipes. And this is the last week of July. And so far, I've only had 8 people, and the 8 have brought by some generous donations. They brought by, several, quite a few items, some of them, and I really appreciate that. But it's really, really slow. So this is the last week. So you can either have it delivered to my home address on Amazon.com, just direct to me, or you can drop it off on my front porch, or you can mail me a small check. And since we're not putting money in the pot, we need to be just a teeny bit extra generous if possible, because there's not going to be any money that I won't have a check to give to them. I'll just have items to give to them. And right now, like I said, only 8 people have brought donations by. My address is 315 North Waddle, Waddill Street, and that's on the beige brick house on the southwest corner of Waddle and Lamar. And I'll type that in on the chat box. I'd appreciate, because this is the last week. Thank you very much.
Thank you, Sharon, and that's definitely a worthwhile goal, and especially right now, it's critical that they do have the hand sanitizers and use every precaution to take care of the coronavirus for sure. Bob Thomas, can you tell us about our... Bob, are you there? Did we lose Bob?
Muted. Bob, can you hold down the space bar? There you go.
I'm okay?
Yep.
Well, welcome, fellow Rotarians, and it's great to be here with everybody today on this virtual Zoom meeting on the 24th day of July 2020. And just want to welcome everybody. And if there are any guests with us, we'd like to welcome you as well. But I would just remind everybody that this date of the 24th day of July is a very important day in our history. On this very date, July 24th, 1911, an American archaeologist by the name of Hiram Bingham discovered Machu Picchu in Peru. And he was led there by an 11-year-old little boy. And this was an ancient Inca civilization that the Spanish vanquished in around 1600. So about 400 years prior to his discovery. And it is, the name Machu Picchu refers to Old Peak. And there's a very majestic hilltop or mountaintop that rises above Machu Picchu, and it's quite an area just northwest of Cusco, Peru. I would also tell you that on this very date, going back a little bit further, 1847, there was a gentleman by the name of Brigham Young who led 148 pioneers into the valley of the Great Salt Lake in Utah. And this is where the Church of Jesus Christ of the Latter-day Saints became established with that first pilgrimage. They were 17 months coming from Pennsylvania to the Great Salt Lake Valley, where they established themselves and the Church of Jesus Christ of the Latter-day Saints. And also on this date, the 24th, in 1969, Neil Armstrong and Buzz Aldrin splashed down, safely returning to Earth, and Buzz and Neil Armstrong had actually spent the night on the moon. I think if you'll recall, Neil Armstrong sent the now pretty infamous quote That's one small step for man, one giant step for mankind. Well, it's great to be with everybody today. We look forward to Danny Kistner's presentation on the fire department and all that's happening in the community of McKinney. So let's get on with it. What do you say?
Bob, I just wanted to interject something. I was reading in the paper this week that actually when he stepped onto the moon, they did not hear him accurately, and what he actually said is that it's one small step for a man, but they didn't hear the A. So that's just an interesting point.
That's great. Thank you. Appreciate you. Bob, have we got any big brag bucks this morning? Bob, you're muted.
Push down the space bar.
Can we hear you, Bob?
Well, we heard that Pete's got a birthday Monday.
Yes,
Yeah.
happy birthday. Push on your space bar.
I'm putting it down.
Okay, you have to hold it down. The whole time you talk, hold it down.
You have to do two things at once.
There you go. Okay.
Okay, you got me?
Yep.
Yeah, we got you.
All right. Anybody for brag bucks? Anybody, anybody, anybody? Going once, going twice. Anybody? Time to take the mic and brag a little bit about yourself, your family, or your business.
Bob, this is Pete McClellan. I've gotten a brag buck. As many of you know, we had a tree land on the roof of our house back on May the 5th. And next Monday, they're actually going to start the repair of that accident.
Well, great. That's wonderful, Pete.
So we're really looking forward to that.
I'm sure you are. I'm sure you will be.
Well, thank you, Pete. Is there any? We have any other?
Everybody ought to know that it's upcoming on Monday is Bob Thomas's birthday.
Woohoo!
Bob.
I think Barbara's planning a special dinner for me, so I'm looking forward to it.
I think
Is that
Doug needs
50% off? Is that 50% off day for Bob Thomas Ford?
Woo! 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 No, not quite, but we'll make you a heck of a deal.
What
Doug,
a birthday present.
Doug, I think you need to lead us in happy birthday.
All right. Everybody join with me.
Happy
birthday to you.
Happy
Birthday to you. Happy birthday, dear Bob. Happy birthday to you.
Wow, that is quite a rendering. That is quite the rendition.
Well, we'll get better each week. Each time we practice, we'll get better.
You bet. Thank you so much.
Okay, make sure you check in on Facebook. Even though you're at home, we're still Rotary, and that keeps the word going out, spreading the word, and gets us some more opportunities for Ron to get some more membership in. So please take the time to do that today. Today we're fortunate to have a great speaker. I was going to let Mark, are you there? Mark?
Yes.
You were going to introduce our speaker today?
I am. Now, did I get on Zoom a little bit late? Did we do our
Yeah, you're late.
prayer? Okay, sorry. Let's move on to the more, okay.
Hey Paul,
yeah,
can you stop sharing your screen, please?
Yeah, I got it.
Okay. All right, go ahead, Mark.
Okay, so we're fortunate today to have our very own Danny Kistner. Danny, Fire Chief of McKinney. Danny is a 29-year veteran of the fire service, currently serving as Chief of McKinney Fire Department since, I believe, 2011. Chief Kistner is an alum of the Kennedy School of Government, Senior Executives in-state, and local government program. Has a master's degree in Fire and Emergency Management Administration from Oklahoma State University. A graduate of the National Fire Academy Executive Fire Officer Program and a Texas Fire Chiefs Academy. He is a designated fire chief officer and has memberships in the Institute of Fire Engineers. Chief Kistner is the current treasurer of the Safety, Health, and Survival section of the IAFC and the chair of the Society and Health Committee for the Texas Fire Chiefs Association. Chief Kistner also serves as a firefighter's life safety advocate for the National Fallen Firefighters Foundation. A lot of alliteration here. Foundation that everyone goes home. That's a lot of organizations. I did want to bring one other thing up before we introduce Chief, and it was an award that he was highly instrumental in helping McKinney get. The McKinney Fire Department received the 2020 Mission Lifeline Gold recognition from the American Heart Association. The award honors McKinney Fire Department for providing superior care and treatment of heart attack patients. So congratulations to our Rotarian and past president, Danny Kistner. Everybody welcome, Danny.
Yay.
Thank you. I'm going to take my mask off while I speak. I was going to do a bragging bucks thing. I just didn't get my arm up fast enough. So I'd like to brag on somebody, and this is an individual that's also going to co-present with me today with 19 years in the field of emergency management, and most of those years with the city of McKinney as our emergency manager, and that's Karen Atkins. And I'm going to do the bragging bucks for her because she is the behind the scenes hero that kind of keeps all of this running. She's going to get into a little bit of detail on how the Emergency Operations Center has been open in a virtual capacity, but has been open since the pandemic started. And probably, though she would not like to admit it, she works 7 days a week, and you're just never off duty during this pandemic. And hopefully, if we don't convey anything else to everybody during this talk, the main thing I want to get across is there is so much that is going on behind the scenes that people just don't know about. That we've got a lot of everyday heroes here on this Zoom call and within the community. And so a huge shout out to Karen Atkins and everything she does for the city and how she keeps us going during this pandemic. And she's going to start off the first part of this talk on some elements related to emergency management and some of the things we're doing on a grander scale than just the city of McKinney. And then we'll segue into what the McKinney Fire Department is doing and what we've done to keep our people safe and the community safe, some of the extra things that we've been doing as well, and how the city of McKinney and McKinney Fire Department is kind of the tip of the spear, or even leading much of the state in some of the prevention efforts. And then we would like to conclude, hopefully we don't talk too long, and we'd like to conclude with some questions from y'all on maybe what we don't answer for you during this talk. Now, as I mentioned, we're all very busy, and it's been busy since the start of this pandemic. Things change on a daily basis. We didn't have a whole lot of time to invest in a PowerPoint, and so kind of keep that in mind as we go through it. If we talk too fast or we give an acronym, some alphabet soup you don't understand, be sure to stop us and we'll stop and explain it. But you're getting a lot of this off the top of our head today. So with that, I'd like to introduce for the first component, part of this talk, Karen Atkins.
Hello, everybody. Happy Friday. So thank you, Chief Kistner, for those very kind words. Much appreciated. It has been a true honor to work for you for the last 10 years. So I'm going to start up our little PowerPoint here, or let me see if I can share the screen. Okay. Okay, I'm not quite sure how to get rid of the next slide there, but, oh, nope, I think we're good. I think I'm only seeing it. Okay, perfect. Okay, so we're gonna jump right in here and talk about COVID-19. So at a glance, we thought this was very telling. We just hit a milestone yesterday in the United States, and we just hit 4 million cases. And if you'll look, it took us 99 days to hit the first 1 million, 43 days to get to 2 million, 28 days to reach 3 million, and it took us a mere 15 days to reach 4 million cases. So that's pretty significant. You know, obviously we'll be watching this as we continue to move forward through this pandemic. So a little bit of data. So this region has been carrying, in our region, our TDM region is about a 19, we're about a 19, 20 county region. And we've been carrying right now about 24% of the cases in the state of Texas, and we're carrying about 24% of the fatalities as well. These two numbers have actually gone down over the last couple of weeks. We've seen a slow, steady decline, which has been a good thing for us. We think part of the decline is that you're seeing places in Texas like Hidalgo and Starr County, down in deep South Texas. They are really a hot spot right now. And so their percentages are increasing, while our percentages here in our region overall have been on a little bit of a decline. And then the occupancy rate and the ICU occupancy rate, this is talking about our hospital healthcare systems. So again, in this region, and these numbers fluctuate daily, but we've been holding right around this 70 to mid 70 percentile for quite a while now. And so basically that means that about 69.5% of our available hospital beds are full right now. And about 74.6% of our available ICU beds are full. And then again, these are decent rates. We talk to our healthcare systems weekly, and you got to put this in perspective. One of our hospitals, for example, before this pandemic started, they were running at over 100% occupancy rate every day, and they were about to expand. And so you've got to put it all in perspective. And not to say that these rates are low, but to say that right now we can absorb additional cases of COVID-19 in our hospitals, specifically here in McKinney. And then they also have surge capacity if they were to get to 100% capacity. And you know, that could be a few significant fires, accidents, etc., that backfills people into the hospitals. And so all of these numbers we kind of have to put into perspective with what's happening today. And then the infection rate I wanted to mention, this is one of the numbers that they seem to be watching. And so the infection rate is how many people one positive case infects. So one positive case of COVID in Texas right now is infecting 1.09 other people. And in Collin County, we're infecting 0.99 other people. So one positive case infects 0.99. Once we get to 0.89, that will be considered a low infection rate. So right now, Collin County is in the range of, we are still spreading COVID-19, but we are doing that spread slowly. And that's good. We want that number to keep going down. So cost and funding, taking a quick little peek at this. So as of this morning, the state of Texas holistically is about $1.9 billion is the estimate of COVID-19 to the state of Texas. About 345 million of that is amounts that counties have turned in throughout the state. I know that number is going to go up because a lot of cities in those counties have not turned in their estimates as of yet for the state. So we're going to continue to see that number climb. So talking about that number, you know, obviously there's been a lot of talk about how we're funding this disaster. So a quick highlight on some of the funding that we're utilizing. So obviously the CARES Act, the city of McKinney received a $10.1 million direct allocation from Collin County. And I believe Collin County received like 171 million overall. McKinney received 10.1 of that. And so we're doing a lot of programs with that funding. And I was going to throw out there, if the group is interested in a lot of detail on the funding, it would be great to maybe seek out Janae Teakin to come speak to you. Her office is running a lot of the 10.1 million is going through her office for housing and for different assistance directly out to the public and our businesses. So she'd be a great person to be able to jump into a bunch of detail on this funding. We also received a Department of Justice JAG grant, Justice Assistance Grant, and that was a direct allocation that they just dumped in our savings account at $60,637. And that funding is going to be utilized to pay for some personal protective equipment in the fire department, actually. So JAG grants are typically law enforcement grants, but in this case, the greater need is going to be in the fire department for the city. So those dollars are coming over to fire to pay for purchases such as overtime, personal protective equipment, and/or supplies like gloves, masks, sanitizer, those different needs. And then we've also received this EMS services direct allocation of $65,000 as well. And it's pretty much paying for the same thing. One of the additions that it can pay for is quarantined employees. So it could also go towards that. And then we have this bucket of money that's called the FEMA Public Assistance Bucket. And FEMA Public Assistance typically is at a 75-25% cost share, which means the local has to pay 25% of the reimbursement request. In this case, for the first time, the federal government has approved that we can offset that 25% local cost share with our CARES Act funding. So, our goal at the end of this as a city is to come out that we've got all of our expenses, 100% covered, would be the ultimate goal. And so with that, we have got a cost recovery task force together in the city, and that has got representatives from every department in the city, including the city manager's office. And we are basically working through weekly calls and discussions. We are working through how we have to collect the data and the information, how we have to file it with these different grants, and what is trying to identify the best approach to ensure that we can get the best return on these dollars that have been afforded to us to come out of this, without a huge effect on the city's budget. So the Presidential Major Disaster Declaration actually started March 25th, and they actually had put an end date of July 25th on it. We are hearing that it should be extended. So they did extend the public health emergency deadline today, but that does not mean the disaster declaration deadline has been extended, but we feel like it's going to follow suit. So hopefully that's going to give us a little extra time to kind of finagle and make decisions on all of these different pots of monies, because they all kind of have different deadlines that we're working with. Okay, so the McKinney EOC. So the McKinney EOC has been activated since March 23rd. So we are in week 18, staring at our four walls down here. And the EOC has no windows by design. So again, we have no natural light coming in or anything, but there's only a small group of us down here. So I kind of wanted to talk about that. So typically when you activate an emergency operations center, you have representatives from every department needed in the city that's responding to that disaster, including, representatives of finance for how are you going to pay for stuff that you need quickly, purchasing, our HR department. Do we have any policy issues that need to, come out of what's happening in a disaster? City management, so there's every department is represented that's needed. And in this case, we just can't do that. It's not safe and it's not feasible. So what we've done is we've activated our EOC, and this is the first time we've operated this way, and we're in a hybrid. So we have 4 people that are in person in the EOC, very small staff. We are all obviously appropriately distanced. We clean all the time. We talk to each other about making sure we're being safe for each other when we come and go, with what we're doing, even with our families. We're just being very cognizant of that. And so we've successfully rolled 18 weeks with no issues on the safety front. And then we also have this virtual component. So this virtual component is making up for all those other departments not being in the EOC. And so we meet weekly with the city manager and all of the directors in the city on a Zoom call, and we basically give an EOC briefing and then discuss any issues that need to be discussed. So it's been pretty challenging because typically in an activated EOC, you can turn around and say, hey, Public Works, we need help with, ABC. And they're right there, the person that has authority for the department's right there, and then they can just get that rolling. Hey, city manager, we're having this challenge, and and how do we want to handle that as a city? So all those things can be talked about right here face to face. Well, that's not happening. And so it's created a lot of challenges, and the biggest challenge is kind of the lag time in information. And so something that would normally take us a couple conversations face-to-face in the EOC may take 5, emails and 2 phone conversations. And so from that standpoint, the time has really expanded and kind of drawn out on how long it takes us to kind of solidify or settle something right now. We are working through it, but it's definitely created a few challenges for us. And then the last thing I really want to talk about is our partnerships. So the partnerships have been so key through this entire pandemic. Obviously, we are all facing unprecedented times. Every one of us are trying to figure out, from our professional life to our personal life, how do we live day to day? How do we do this? How do we handle our children that are at home? Everything's changed. If both spouses are working, if they're not working, our business lives have changed. And so these partnerships that we have developed and that we've had through this entire pandemic have been so key. So the first one I just want to point out is the Texas Division of Emergency Management. So we are on a call every morning at 9:30 with the Texas Division of Emergency Management, and they are giving us that state picture as well as our state's regional picture. And so there's a lot of data that comes down. If there's been any new programs that the state is going to release, any new information on the funding, just anything we need to know that we need to pass on to our cities, it's on that call in the morning. And so we participate in that daily, and we've done that, oh gosh, for I guess the last really 18 weeks. And then Collin County Healthcare Services. Obviously, this is a public health emergency, and so they have just been instrumental. We have worked with them hand in hand from the beginning of this. We also have a weekly meeting with them. That meeting is an update meeting. So we talk about all the different facilities, whether it's businesses, daycare, schools, long-term care facilities in the city of McKinney that have been directly affected by COVID and that may be shut down, or that may be having challenges because of that, or that may just be under their monitoring. And so, and part of this discussion is, if a long-term care facility or even a business, if somebody needs testing and they cannot do it on their own, then the mechanism is to put in what's called a State of Texas Assistance Request, or a STAR, and that STAR goes through the local McKinney EOC. So we stay in touch with our healthcare services partners for many reasons, so that we are situationally aware of what's happening in the city. It's a great Q&A time for us on the health front, as far as making sure we are doing the right things, which Chief Kistner will go into much more detail on the EMS component of that relationship. And so it's that I just can't speak more highly of our Collin County Healthcare Services team and the job that they're doing. And I feel like I've worked a lot, but they've put me to shame, the hours that they're all working. So if you ever see those folks, please, tell them thank you. They're working really hard for us. We also have our long-term care facilities. And so these are all of the assisted living facilities, memory care, independent living, and our nursing homes. We have been in touch with them from the beginning. So the first several weeks of this, we literally did daily welfare checks to every facility. We've got probably 35 to 40 on our list, and we were calling them daily from the EOC. We are now down to calling them twice a week. And part of that is just, things have kind of settled out. A lot of processes have been put in place. And then the other piece of it is we've been building that relationship with them, where sometimes if they need something, they just pick up the phone and call us instead of us having to call them. So that has been a very advantageous relationship. And again, if they had a STAR request early on for PPE, which was at a deficit early on, a lot of them were struggling. And you saw some of our facilities in McKinney that had some really challenging times and lost some residents. And some of that was, just lack of personal protective equipment. Some of that was needed training in the facility. Some were staffing issues. And so we've just been here to partner with them and try to help them through that and help them turn those situations around. And now we've got a process in place that's pretty good. And so we're catching, anything that could turn negative, between us, Collin County Healthcare Services, and those facilities. We're catching it pretty early and getting on top of it very quickly. So we welfare check them twice a week, and then we actually host a meeting with them on it. And then we ask for their input. We ask them what challenges they're facing. Is there anything we can help them with? And so we have this meeting weekly as well. And then One Heart McKinney. One Heart McKinney, if you've not heard of One Heart McKinney yet, it's an awesome organization that has come up to help the community-wide effort to respond to and recover from COVID-19. It's kind of your one-stop shop, so please spread it around. It's oneheartmckinney.com, very simple. And every dollar donated is distributed to local nonprofits to help feed, shelter, and try to keep healthy our community. So they're doing a lot of great things. They've already given away, I think it was about $94,000. And we have about the same left to give away in One Heart McKinney. And so they are doing great work. And right now, if anybody needs them, they've got masks available for local businesses to help patrons comply with Governor Abbott's executive order. And then our last partner is our medical task force, and Chief Kistner is going to dive into that.
Thank you, Karen. A lot of information in a brief amount of time. That could probably be a program in and of itself, just talking about the EOC and what everything it is that they're about. So it's obviously a medical crisis that we're in with the COVID-19 virus. And so one of the things we established early on was a medical task force. And the medical task force consists of our medical direction team, infection control experts, Collin County Health Authority, and various other representatives that provide advice to us on our operations and daily activities. So backpedaling back, to February, March, we were getting warnings from the medical community overseas and as well as local that this thing was kind of brewing in Wuhan, China. And we were suspicious early on, back in even December, January, that even though we were being told that this virus was not transmissible from human to human, we had suspicions that it was. We were getting early indicators, warnings to go ahead and start purchasing PPE before the availability got hard to get equipment. And so we already had a stockpile from when Ebola hit. We kind of overbought in that regard. And then we started ordering and making preparations for this potential COVID pandemic. One of the things we did early on too was look at pandemic flu emergency action plans. And Collin County had one that we referred back to, and I recall back my days in the 90s where that was part of the emergency management plan, was to prepare for a flu pandemic. You know, fortunately never happened, and so we got a little complacent and didn't keep things up to date, but we are now. So one of my biggest concerns as the fire chief was, how do we prioritize for the safety of our firefighters that are going to be responding to this emergency, and then keep them in service, as well as the safety and the health of the community. I mean, we certainly didn't want to cross-contaminate, or our EMS people that may unknowingly be infected, transmit that to the patients that we may be responding on. And it's not just on EMS calls. Frequently when we go to service calls or fire emergencies too, we're face-to-face with the general public, and you really don't know who's got it, who does not. So that was one of our concerns, is what are we going to do and how are we going to respond to it? So one of the first things we implemented very early on, which I think is one of the reasons we've been so successful in keeping COVID-19 out of the McKinney Fire Department, was we implemented daily temperature checks and viral screening. And what a viral screen is, it's just a questionnaire or a quick survey that if you answer the affirmative, I've got this symptom, I've got that symptom, I've been in close contact with somebody that has COVID-19. If they test positive for any of that, then we send them home immediately. And they do this at the very beginning of every shift, preferably before they report to duty. But if they haven't, before they're allowed to enter the fire station, they do that, and they check their temperature. If it's above 100.4, they go home. And we have it at that level because there are not all thermometers are equal, and things such as that. So that allows for a margin of error. We also check it twice during the shift. We check it mid-shift, and then we check it before a firefighter goes home. and hope to prevent transmission to their family. We implemented a mask policy. If people can't physical distance of 6 feet or greater, they have to wear a mask. We recently updated our mask policy as well too, so they have to wear it in an apparatus. Basically, if you're coming in contact with people, you have to wear a mask. We have a presumption that everybody has COVID until proven otherwise. And so you'll see firefighters when they respond, they're going to have, or they better have, their PPE on, including their mask. We did a series of public service announcements and our Facebook. We showed the citizens, the community, what we would look like and not to be afraid of us. And it's for our protection as well as their protection. And that's why we were doing that. And then we implemented something that I think has been very successful, and that's early on, back early March, we started conducting what I call a daily health briefing. It started off small, and it started with just the command staff and fire administration, where we gave an update on what we know the situation was occurring at that moment, and then we would query every member and ask them if they had any comments, concerns. Is there something we're thinking or not thinking about that we should be, or something we're not talking about that we should be talking about? And then that just kind of elevated to where we have a daily health briefing for the entire shift. And these occur at 8:15 every morning. Part of it is a reminder that it's so easy to get complacent, that here we are, how many months into this emergency, and especially if you don't know somebody or haven't had direct contact with somebody that's got COVID-19, it is so easy to get complacent. And human behavior being what it is, we want to get back to our routine, to our familiar, to how we enjoyed life. One of our fears early on is that we're going to take all this preparatory processes, implement it. We're not going to see the numbers that we were expecting, and then we get complacent, and then all of a sudden the numbers start to spike. We're seeing now what we were originally expecting to see back in March. And I think my personal opinion is the same thing's going to happen again once these numbers come down, the infection rate comes down below the 0.89 that Karen was talking about, that people are going to get comfortable again and get complacent again, not wear the mask and not physical distance, and then we'll see the numbers rise up all over again. What the science is telling us right now is that COVID-19 is here to stay until we develop better treatment regimens or vaccines. And so that's our daily health briefing. And so also during this, we had to modify our response. Like I said, it's such a contagious disease. How do we protect our firefighters so that that we don't have staff get down to zero, and then we become in crisis mode? We don't have enough able-bodied persons to respond to emergencies. And so we implemented a lot of things with the city's support and the city's backing. And one of them is what we call Med-19. Med-19 is putting a paramedic in our dispatch office, in the communications office, to where somebody calls in, the call taker answers the phone, we have emergency medical dispatch. So there's a series of questions the dispatcher will ask based on this established program. If any of those lead to the potential of the patient describing flu-like symptoms or a number of related things, then we transfer that call to Med-19 or our paramedic in the dispatch office, which we staff 24/7 around the clock. That paramedic has their own protocol that they'll start talking to the patients. And at that time, and well, it still is actually, where if the patient is likely or there's a high index of suspicion that they have COVID-19 with very minor symptoms, then we give them a series of options based on protocol from our medical direction team. And one of those options is stay at home, monitor yourself at home. We offered, and a lot of patients would take us up on this, we offered to do a callback either that day or 24 hours later, and we're still doing that. Also, this paramedic has the ability to FaceTime some of these callers and these patients, where we can actually lay eyes on them and kind of determine their condition and help in the decision-making process. Do we need to send an ambulance or not? And the intent there was to help protect responding firefighters so they know what level of PPE to put on responding to the scene. It's also meant to help the patient not incur unnecessary cost. And at the time we first established it, testing was at a premium, and there were certain people that weren't getting tested anyway, so that the test could be maintained for the more sick, I guess, if, for lack of a better way to put it. And then we put in service what we call Med 51 and Med 52. At the peak, we had 2 ambulances dedicated solely for the transport of patients that we felt were at high risk, or we had a high index of suspicion to be COVID-19 positive. Now, these ambulances, we retroed and put plastic and took out unnecessary equipment, do things like that, so that decontamination would be quick and easy. We also sealed off the driver from the patient compartment to protect the driver. And so we assigned 1 individual to each ambulance, and that person just stayed in the front of the ambulance. We had enough crew, and I'll get to the additional crew in just a second, but they would respond to the scene, and they would just stay in the vehicle. They would not get out. If transport was necessary, we would transport to the hospital. That driver would still stay in the vehicle, not get out. Other firefighters would take care of that. And this all hastened decontamination. If we didn't do it this way, decontamination could take up to an hour. And when our normal call volume is 40 to 50 with 6 ambulances a day, that was unacceptable. And so this was doing it this way kind of reduces our decontamination time to about 20 minutes. And then our squad 1, that's our community healthcare paramedics. We dedicated the community healthcare team to respond to all COVID-19 related or high index of suspicion calls. Now, we did that because we needed a very high level of expertise to respond to these calls, and something a crew being dedicated, that's all they're thinking about is COVID-19 and how do I prevent myself from catching COVID-19 and how do I prevent it from passing it to somebody else. And the decontamination, there's so much detail involved with this that we wanted a dedicated crew that's all they're focused on 24/7. And so our community healthcare paramedics were that crew. Now, our because of the COVID and because a lot of our community healthcare patients are at very high risk, we transitioned to telephone FaceTime to take care of most of those patients. There's very few that we still see face to face, but everybody's wearing the appropriate PPE before we do that. And then we also created a registration on our webpage that somebody that has COVID-19 maybe doesn't have a lot of family, and they just want somebody to check on them periodically, we offer that. They can go online and they could register, and then we'll call them. Our community healthcare paramedics will call them just on 24 hours or even at smaller increments. EMS2, we put a extra supervisor in service. I think this is another reason why we've got no spread, and I'll caveat that in a moment, but we have no spread within the McKinney Fire Department, is when we decon, if we have a supervisor there, they're hyper-focused on the decon procedure, and nobody's taking any shortcuts or getting complacent. And if they see a supervisor standing there, they'll make sure everything's done right, and it's done the same way every single time. And then we've modified our on-scene response methodology. If we could talk the patient into coming outside, if they're able, and talk them into coming outside to talk to our responders, then that's preferable because it puts you in the open air, you got less risk of transmission. If they can't come outside, then we send 1 paramedic in complete PPE, the gowns, the masks, the goggles, everything, to go in and assess the scene, assess the patient before committing other responders inside. And that has been crucial. We still do that to this day, and we'll probably be doing it for a while until a vaccine or something else comes along. We do not delay life-saving care. because of the risk of COVID-19. If we have a life threat or somebody calling in with a life threat, then we'll send in as many people as we need to, all wearing the appropriate PPE. And this is what some of that PPE looks like. When I introduced this section, I said that McKinney Fire Department is really the tip of the spear. We really got ahead of everybody else and ahead of the curve as far as our response to the COVID-19, and also as far as risk assessment. That I think we were able to perfect a lot of the methodology to a lot of different aspects of the response. And then a month or so ago, a couple months ago, I guess it was May actually, and the governor put out an edict where every licensed nursing home within the state of Texas would be tested, staff and residents, for COVID-19. That was a broad order. And the emergency manager for the state of Texas, Nim Kidd, said, well, you know who's perfectly poised to do this, and that's the American Fire Service. And so they challenged the Texas Fire Service and Texas fire chiefs to commit to testing the long-term care facilities, and actually start off with licensed nursing facilities. Well, we had a conversation with the emergency manager at the state, and told him it's a little more complex than just say, hey, fire service, can you go test everybody? There's a methodology to it. There's an infection control component. And following that conversation, the state said, well, come talk to us and show us how you do it. And so we sent one of our captains to the SOC in Austin and to help develop the process. And that was pushed down to the region, and that's the DDC 4B EOC liaison, and the McKinney Fire Department sent another one of our individuals. So we had somebody in Austin, we had somebody at the region to help coordinate this effort. And we had we created an emergency medical task force team, so teams that are highly specially trained using the methodology that we came up with to go in and test staff and residents. And so they've been doing this since, I guess, April or May, testing all our long-term or licensed nursing facilities, and that's kind of escalated into a lot of the long-term care facilities as well. And so that continues today. This photograph is another example of how that looks. The level of PPE changes, and I will say what they're dressed in right now is probably a fairly low risk of individual that they're swabbing. The very high risk, sometimes we've gone into wings of long-term care facilities. And when I say that, it's for all of North Texas. It's for this whole region, which is about 19 counties, give or take. And so we've gone into some nursing homes that have had wings of COVID positive patients that had to be tested. And we would wear a garment called a PAPR, which is self-encapsulated. It's got an element or a breathing hose that goes into the mask, and there's just no way virus can enter into it. So a little statistic here is since we started doing these tests, and there's very few teams in the state of Texas that started doing it. We had Dallas, we had MedStar out of Fort Worth, we have San Antonio Fire Department, McKinney Fire Department, Plano Fire Department, and Dallas for a period of time. Now, the only two entities in North Texas that are doing it are the Plano Fire Department and the McKinney Fire Department. And it is our understanding that Plano will discontinue July 31st. But anyway, there's been individual tests. There's been over 18,000 individual tests administered in just that short amount of time. We've had combined of all these teams, 140 missions, and 133 are complete. That's a real quick snapshot, but what's the new normal? What does the new normal look for us? As I mentioned also earlier in the introduction, that coronavirus or COVID-19 is not going away. One thing that we're able to purchase, or we have purchased through the CARES Act funding that the City Council authorized, is a communicable disease resistant ambulance, if you will. It's got LED lights, UV lights inside it that help kill virus. It has triple HEPA filters in it. It's got negative pressure in it. It's got a completely sealed compartment from the patient compartment to the driver. And it's just, it's a lot easier to decontaminate, and it's a whole lot safer than the ambulances we have now. We're purchasing more aeroclave decontamination units. And basically what that is, it's a unit that aerosolizes disinfectant, and then we can use that to spray inside an area and decontaminate it a lot faster. We have been asked by the state to consider being an infectious disease response specialist for the state, and I'll say that that's something we actively want to pursue. It also opens up a lot of grant money and training and that kind of thing, which would be very beneficial for us. Personal protective equipment, as in the 80s, wearing rubber gloves, vinyl gloves, because of AIDS became the new normal. We're wearing gloves today because of the AIDS epidemic. Wearing masks is going to become the new normal. Wearing PPE is going to become the new normal for us. So personal protective equipment and its availability is going to be an issue. Right now, we got a pretty good store of PPE, and we're ordering more. We're anticipating another spike of not only COVID-19, but regular flu here coming in this next fall, winter season. And again, we want to keep our people safe so that we don't have too many out sick. And we don't want to spread the disease to other people as well. Office building modifications throughout the city. There's been modifications to working space to help maintain the 6-foot physical distancing. Splash guards have been put up. More protections for employees and staff. Telework is active within the city right now. We're what we call a phase 2 reopening. And in that, if somebody can work from home and still be productive, that they're encouraged to do so. And one thing we're going to be piloting here very shortly is telemedicine, where you could have access to a physician on your smart device 24/7, and maybe get that advice from the physician. Do I want to call 911? Do I need to go to the ER? And that's coming pretty soon as well. And I'm sorry, I'm trying to talk fast because I know I'm getting close on time. I think I got one more slide though, if I hit the right button. Oh, there we go. I'm sorry, I wanted to leave a little more time for question and answers, but Karen and I will stay available on the Zoom call to answer any questions you might have. I hope that gave you a good picture of the snapshot of what's kind of going on behind the scenes here.
Danny, you have 3 questions in the chat box. First question from James is, where can we get a box of masks?
Okay, how do I get out of this so we can see this?
Hold on.
Unshare. Oh, stop share. There it is.
Stop share. Okay.
There you go.
Let's see, I'm trying to get to where I get the gallery view where I can watch you.
And if you'll click on the chat, you can see all the questions in the chat too.
Oh, okay.
So if it's for a business, they can try One Heart McKinney.
Yeah, Karen was just reminding me that if it's for a business, you can try One Heart McKinney webpage, and they got masks available. There's a number of sites you can go to, just Google and they'll show up. The N95 masks, they're reserving pretty much for healthcare. So those will probably be hard to come by, and same thing with gowns, medical gowns. That kind of stuff is being intercepted and sent to healthcare providers. But One Heart McKinney, they just received a stock of masks, and those I believe are washable, reusable. Thank you for the haircut comment.
So the next question.
Okay, here's a question. Why do police officers not wear masks, at least until the mayor made it mandatory? And I really can't, I mean, every director is giving the, and maybe Doug could chime in on this, but every director is giving the autonomy to decide what's best for their particular department. We're doing what we're doing because our people are directly face to face with the virus, and Doug, do you want to comment on the police side?
Yeah, pretty much we've been following the lead of the Prosper Fire Department over here and coordinating with our human resources. We basically mandated that our officers get their temperature taken every day. They come in, same thing with dispatch. We closed off the public part of the building where people couldn't come in and interact with dispatch. The officers were told to limit their public contact. Dispatch was told to ask people to come outside and meet us. And our officers were given, once it was available, appropriate personal protective gear. So when we contacting people, we are wearing our masks and gloves and desanitize. And if we come, we've had to send a few officers home because we've come in contact, we think, with people. They later tested negative. We used the fire department to decontaminate our vehicles, so they don't come back in the building. So we've been doing all that for since sometime in May, and we're continuing it.
Hi, Dan. This is Sharon Scott. Just a public thank you. In late 2013, a few months before my mother died, she was on the stair lift going upstairs to go to bed. It was after midnight, and she slid off the stair lift and was kind of crammed between the stair lift and the railings of the stair. And I tried and tried and tried to get her up and back on the stair lift, and I could not do it. And finally I told her, I said, Mother, I'm going to have to call the fire department. My foo-foo mother says, I don't have makeup on. I'm in my gown. I said, she's 91 years old. And she said, I said, I have no alternative. You can't stay here forever. So anyway, 2 of your men came out, and they had a little bit of difficulty also in the cramped stairwell, but they got her up and got her into bed, and they could not have been more reassuring to her, more nice, more kind. And I'll always remember that because she died just a couple of months after that. And she really appreciated so much, as did I, how they treated her. So thank you very much.
Oh, thank you for sharing. Let's see. Next one is, can we, oh, yeah, Doug, yes, we can. We'll send it to you.
Thank you.
Danny, Carol put one on there about the hospital occupancy. Do we know what % is COVID-19 versus the total?
We get daily updates. I don't have what it is today, but I'll say that most of those are not COVID-19.
I know it used to be in the posted every day, and the number of COVID cases were actually like 19 or 20 or something back when they were posting it regular versus 69%.
Yeah, it's not going to be much different than that. So, yeah, and when you see a lot of the numbers related to COVID and occupancy, what they're talking about mostly is they've got a number of beds that are in rooms that are negative pressure, and so they're relating it to the availability of those rooms. But right now the number, I don't have them for today, but it's fairly consistent to what you were referring to.
Karen and Danny, this is Bob Thomas. And Karen, we've been hearing quite a bit about Nueces County, and Nueces County has a number of babies that have contracted COVID-19. And I was just wondering, are we having some of the similar challenges here in our area, our region?
Yeah, no, not like that. I believe there was 85 babies that tested positive for COVID-19, and right now it's kind of an anomaly. And I know the medical community is kind of looking into that. South Texas, I know is a very hotbed. I think we were told the other day they have they're seeing maybe 35 fatalities a day in Hidalgo County, and one of the biggest, fastest growing demographic of COVID-19 is Hispanic male between 30 and 39. They're attributing that largely because of the family unit and being out in the workforce face to face and that kind of thing. So it's it seems like it seems like there is a unique qualifier in different areas, you know, as to what's causing the spread. But, you know, state of Texas, South Texas right now is getting hit heavy. I know they're asking for extra resources. They're sending military resources. They're asking for doctors, nurses, ambulances. That's one place we have not been able to go to yet, because all our additional resources have been used here local with our EMTF, and we were just kind of overwhelmed. We also had sent, at the same time all this is going on, we had sent a unit to fight the wildfires in Dumas. And so we got to remember, we're not still dealing with only COVID. The world still goes on, and we're responding to the normal emergencies that we always have. Now, right off the bat, when people were afraid to get out and we had the lockdown, we saw a 20% decrease in our calls for service. We see about 45 calls a day, I guess, on average, and that dropped down to 20 to 30 during March, April, May, when everybody was afraid to get out. But we're right back to where we were before. And so we're dealing with our normal call volume plus the COVID volume, and then our normal activity of supporting the wildland groups and things such as that. So pretty busy time.
Karen and Danny, what about our own Justice Center right here in McKinney?
So both our Collin County Jail and our Collin County Juvenile Center, they have had positives, and so that Collin County healthcare component I talked to you about earlier, they are definitely engaged with those facilities daily, and so they're basically under monitoring, just like any business in McKinney or daycare, anyone else who has multiple positives, and so they are both under monitoring. And they are working, you know, to clear them. Once a facility goes under monitoring, you're probably a solid 28 days from becoming clear, and that's really only providing you don't continue to have cases. Like you kind of get that stopped and cleaned up. So basically, it's going to be 14 days after the very last exposure of the last, you know, positive case, basically. Then there's going to be an additional, you know, 14 days on the back end of that before they'll consider a place clear, and of course they've got to be a negative on any cases.
Wow, Danny, I certainly appreciate you coming today, you and Karen. I know some people has mentioned to me they've got to get out and get on, but I really thought your talk and Karen Aiken's talk today was so informative and so helpful, and certainly I'm going to share it. With your permission, I'd like to share it with some of our staff, because I think it's really would be a benefit. It was a great presentation.
Oh, absolutely.
Well, thank you so much. And I know that, like I said, we've got to get out, and we've got some more meetings set up. So I appreciate y'all coming today. And y'all have a great weekend. And we look forward to seeing everyone next week.
Thank you. Thanks for having us.
Thank you, Karen and Danny.